But one thing I wanted to mention to you that I've been focused on recently is the omega-6 fatty acids, linoleic acid. There's a really good paper out from a Japanese group, which I can send you, and I don't have the name off the top of my head, showing that probably the biggest environmental factor that's increasing the risk of insulin resistance, diabetes, obesity, Alzheimer's, possibly Parkinson's, and definitely obesity seems to be the increase in linoleic acid, which is an omega-6 fatty acid, which people have always regarded as essential, meaning you need a little bit in the diet because your body can't make it. That was the thinking for many years. That's what I learned in medical school a long time ago. Just like you need some of the, at least one omega-3, this alpha linolenic acid. And then there's some other omega-3s that you presumably can make, although you don't make it very well, the DHA and EPA. So often it's good to get that in your diet or by supplement. But the omega-6s we have way too much of, and we started getting too much.
Yes, corn-fed industrial farming, right?
Yes, and so there's a great talk on YouTube by Chris Kenobi, who's an ophthalmologist from a couple of years ago, and he's had some other updated talks where he discusses the epidemiology of this. It's kind of hard to show causation because you can't do a randomized clinical trial where you give a bunch of people omega-6 and others not. But you can look at just the correlation between the intake of omega-6 going up like crazy. Now it's in everything. You know, if you look at almost anything you buy, it's got soybean oil. So it's the seed oils, basically. Canola oil, sunflower oil, all of these types of vegetable oils.
I think it's in this corn-fed industrial farmed beef too. That's what they say. The difference between like the grass-fed organic beef is good for you, and
that's interesting. You know,
and it could be muddling up the studies about cancer from beef and stuff. Like,
well, that's very interesting. Now, I've heard Paul Saladino, MD, who's the carnivore MD. He's talked a lot about seed oils and getting them out of your diet.
Right.
But he talked about chicken having a lot of it, but beef having less. Maybe that's because he's using the grass-fed, not the corn-fed. But that's a great point. I mean, the chickens are somehow getting it through their feed, and they're having more of the linoleic acid whereas beef has more saturated fat. And it turns out, you know, the American Heart Association recently did an about-face about a year ago where they said, we no longer think that saturated fat is bad for you. We've been telling you that since the 1970s after the Ansel Keys studies. And one of the guys who's been most influential on this is Walter Willett, who's the head of the nutrition department at Harvard School of Public Health. He's been writing for probably 40 years, and I used to read him back in medical school, that you need to replace the saturated fat in meats and cheese and butter with unsaturated fats from seed oils. You know, the more soybean oil you can eat, the healthier you'll be. And the thing is, it appears that's wrong. And you wonder, why was he saying it? It appears the reason people have been pushing it is they do lower your LDL cholesterol. So, but that may not be good.
Right.
So it turns out, you know, after you've had a heart attack, and particularly if you're diabetic, lowering your LDL definitely improves your survival with a statin, for example. But if you haven't yet had a heart attack, lowering your LDL doesn't appear to help you at all in terms of coronary events or death. But what does make much more of a difference is your triglyceride to HDL ratio. If your triglycerides are high and your HDL are low, that correlates very well. A ratio above 2 correlates very well with coronary disease, the presence of it and the extent of it. People with the ratios like up around 5, 6, 7, you do a coronary angiogram on them and their vessels are filled with plaque, and they often are either have had a heart attack or about to get it. So focusing on triglycerides and HDL seems to be more important than LDL. And if you go on, let's say, a carnivore diet, or you're having a lot of saturated fats, but you avoid the linoleic acid, the health outcomes appear, we need longitudinal studies, more of them, to be pretty good, even if your LDL is high. So Walter Willett's thinking was always, well, get your LDL down low. And just because, you know, so you should be taking more soybean oil. But this paper I will send you from the Japanese group says that he thinks linoleic acid is the main culprit in Alzheimer's. So it's very interesting. And it has to do with oxidation. You know, the linoleic acid gets into the cell and it gets oxidized into these byproducts that do a couple of things. They cause hyperphagia. When you feed linoleic acid to mice, they start eating and get very obese. And it's because one of the intermediates from oxidation of LDL or of linoleic acid is, I think it's 2-AG. It's something that goes into the brain and causes your hypothalamus to tell you to eat a lot. You become hyperphagic. That's one thing. And so that may account for the obesity. And then the other thing is some of the other oxidation products are causing mayhem in the cell. They're disrupting LDL metabolism and so forth. So this is an active area of study, but since I learned this, I've cut out a lot of the LDL I used to eat.
Okay, so I want to move into
Not LDL, pardon me, linoleic acid.
Yeah, yes.